The woman who spoke to this newscast on the basis of anonymity said she received her first dose of the Sputnik vaccine at a Bedford-Wacton Health Center on June 3rd of this year. She was scheduled to get her second dose of the Russian-made vaccine at the same vaccination site on Thursday, but instead was given an AstraZeneca shot. When Nightly News inspected her vaccination card, it was confirmed that two different vaccine types were administered to the woman for first and second doses. When contacted, advisor to the Minister of Health, Dr. Leslie Ramsammy, assured that although Guyana has not adopted policies that allow for the mixing of vaccines, there will be no serious consequences on the woman's health.
Mixing of the vaccines is not harmful. In many countries, it's done as a policy. Some countries have scientific evidence that the mixing of the vaccine might even be superior than using the same vaccine. And so I want to assure them that it's safe to do so.
The devastated woman told Nightly News that after receiving the AstraZeneca vaccine for her second shot on Thursday morning, she informed the vaccinator that she should have gotten Sputnik instead, but the healthcare worker informed her that the vaccines are the same. She said she was observed for approximately 15 minutes, then was sent away. At the time of speaking with Nightly News, the woman complained about experiencing chills and was literally in tears. Dr. Ramsammy made it clear to this newscast that the healthcare worker who gave the woman the dissimilar second dose was not advised by the Ministry of Health to mix the vaccines, and that decision was taken independently by her. He cautioned healthcare providers to consult their superiors before taking such steps.
Our advice is people show up and request a different vaccine, that the nurses should consult with their superiors. In this case, it doesn't appear. Doesn't appear. I know for sure that the person did not request a different vaccine. A nurse took it upon herself to make that decision. So we are making sure that nurses do not do that.
Underscoring that accessing different doses of COVID-19 vaccines is not in any way dangerous, Dr. Ramsammy highlighted that many persons in Ghana who have requested to access their booster shots from a different vaccine type have had their request granted. When questioned when and if health authorities will move towards the position taken by many countries to include the mixing and matching of vaccines in its inoculation program, Dr. Ramsammy had this to say.
We constantly review how the system is going, and we have followed the one that the WHO has instituted. But we are constantly reviewing it. So we have not yet made any such decision.
The Oxford AstraZeneca COVID-19 vaccine uses a chimpanzee common cold viral sector, which delivers the code that allows cells to make the SARS-CoV-2 spike protein, while the Sputnik vaccine are adenovirus-based. Temika Rodney reporting for the HGP Nightly News.